is Ron Greenberg, president of HealthxMD. I'm joined by Dr. Jerry Sood, president of Novus Clinic in Akron, Ohio. Jerry, thanks for joining us today. I appreciate your time. Jerry, if we can start out, if you can just describe Novus Clinic briefly for us, I'd appreciate that.
Yeah, thanks, Ron. Novus Clinic was actually the first true OD-MD true stock partnership in the country. And presently we have 7 locations. We do have our own ambulatory surgery center. We have 13 ODs and 4 ophthalmologists. We practice pretty much every aspect of care in the eye industry, from neuro to anterior segment plastics to general wellness exams by optometry.
That's a pretty big practice. So Jerry, you've been a client of HealthxMD for a little over a year. We had the opportunity to speak to Dr. Johnston for the purposes of this interview as well. Gave us some great information as to what's going on clinically within the practice. But from your perspective as president and founder of the practice, what went into your decision when considering adding transcranial Doppler to your patient portfolio?
That's a great question. So many diagnostic tests come across my desk on a monthly basis. Some make sense, some don't make sense. Many of them are very redundant with things that we're already doing. So the first thing that hit me with transcranial Doppler testing, it was not a redundant test. In other words, the benefits we get from that test, we are not getting from anything else we're doing diagnostically in the office. The fact that we're able to pick up vascular issues as well as normal tension glaucoma, which is very difficult to pick up by any other means, makes this test invaluable for our patients. So once we checked out the test, the credibility of the test itself, we decided it made total sense for us to implement this in our practice.
A lot of questions that we get when a physician or administrator are considering adding HealthxMD to their practice diagnostic platform is transcranial Doppler testing. I'm an ophthalmologist. What does this have to do with ophthalmology?
So the key is, one of the things that's really important to understand is medicine has changed dramatically. And one of the things I think is important to understand is we're in a coordinated care environment in medicine. And what I mean by that is we should be doing things that normally we would have considered to be outside of our realm, and share that result with fellow physicians, whether it be primary care physicians, cardiology, or whatever it might be. So to me, it's a perfect fit in the existing environment with coordinated care, the way we're practicing coordinated care. The fact that I could pick up a patient that's high risk for stroke, send that information to this patient's primary care physician is invaluable. And I'll tell you, the medical community has been very appreciative of the fact that we're doing this, and they see huge benefits. So we have to start thinking a lot differently than we did years ago. What
has the feedback been from your patients?
Feedback from my patients has been very, very positive. When I talk to my patients, due to they have risk factors that would put them into a bucket, high risk for stroke and possibly for normal tension glaucoma. They're very receptive to having the test done. The fact that I personally call my patients back with the results makes it even more impressive. So, and the fact that I'm telling my patients the risk factors don't go away, this test should be done yearly, I get very, very little pushback from my patients simply because they understand the benefits.
So Jerry, we were talking before about the impact to the practice and why you brought it into your practice. One of my questions was the feedback you've gotten from your patients that have had a transcranial Doppler test.
So the feedback we're getting from my patients has been very, very positive. Understanding the diagnostic ramification of this test, that we can actually help pick up patients that have vascular risk factors, that we can actually pick up a patient that may be close to an event is really, really important. And patients appreciate that. Secondarily, the fact that we can pick up risk factors for normal tension glaucoma, which I think we know is very difficult to pick up by any other method. When you have a patient that has normal cup disc ratios, normal pressures, and no family history, yet we find that has reduced blood velocity to the through either the right, left, or both ophthalmic arteries to the optic nerve, that we're able to pick that up and then do some diagnostic tests, do an OCT, and find out we have damage in one or several quadrants. There's no other test that allows us to an entree into that kind of diagnosis.
Jerry, a significant optical lab manufacturer several years ago did a study of 2 or 3 of the leading HMOs and commercial insurance companies. Basically, they said that if a patient 45 or older sees their primary care physician once a year for a physical, they go see their dentist once a year or twice a year for teeth cleaning and a checkup, that at 45 or older, if they have glaucoma, retinal disease, contact lens wear, whatever it is, they're going to see their eye care provider probably 3 to 4 times per year or more than they're going to see any other provider, unless there's a designated event like they have to go see an orthopedic surgeon or something else is going on, a specialist.
That I agree with. If it's a medical patient, okay, with one of those conditions, or even dry eyes, it's certainly not unusual for us to have those people back quarterly or more. Okay, so the answer is yes. I would agree with not knowing that data. That's very interesting, but it certainly makes sense to me.
And as a follow-up to that, so what we're hearing now from physicians, I might have even heard it from you in the past, is that with the patients sitting in our waiting room every day today, and considering the pandemic environment we've been in, it is critical that those patients who are coming to see us, that we expand from just quality of vision to a quality of life-based solutions. Is that a philosophy you think that is expanding in eye care?
Yes, I think so. I think I think we look at, we need to look, if we're not now, we need to look at patients differently. Okay. And when patients are coming in, the whole wellness factor has become so important. It's not a matter of, we have to become as an industry much more proactive versus reactive. And I think patients expect that. And as doctors, those are the doctors that patients are going to want to see in the future. So I think that the fact that we're proactively offering diagnostic services that are going to pick up things that may be an issue down the road versus today is very, very important in the minds of my patients, and I think all patients.
So although I am committed, as is HealthxMD, to providing the best diagnostic platform for our clients, I want to switch gears briefly before we're finished with you today. Put on your president's hat. We are in an environment of private equity, of practices either selling or acquiring or expanding. As a business leader within your practice, what role do services like HealthxMD have in increasing your revenue per encounter and adding to the valuation of your group?
Yeah, so first and foremost, TCD, transcranial Doppler testing, has been a huge benefit to patients, okay? Secondarily, it's been a huge revenue producer for us as well, which not only is good for the financial health of the practice, but if someone was looking at increasing their valuation, TCD will have not a small but enormous impact. The fact that it's not a one test and you're out procedure, the fact you have this test either twice a year if it's positive or if it's negative once a year, this is an ongoing revenue stream that's probably more significant than anything else I've seen in 49 years of practice. So financially, it's a huge windfall. And again, we're all looking at increasing valuations, whether we're looking at selling to private equity in the future or not. This will have a huge impact on the sales ability of your practice and your valuation.
I did hear a comment from an administrator who told me that when he looked at his revenues coming in through HealthxMD, he would have to do the equivalent of 3 times the ophthalmic diagnostic testing to generate the same income he's producing through HealthxMD. Would you agree with that?
Yeah, I mean, I do. I mean, if we look at the reduced reimbursements that we're going to be seeing in the future, cataract reimbursements are going down in 2021. A lot of other reimbursements may be going down. The fact that we now have a terrific diagnostic test that dramatically is increasing our revenue. I think you said three times or 3 to 1 makes total sense to me. We're seeing it in our practice.
last question, and then we'll let you go, is that some doctors have expressed some concern that we're putting a burden on the healthcare system by ordering TCDs for our patients. Do you have a sense, and I don't know the exact answer, what the reimbursement comparison between a TCD and an MRI or an MRA?
Well, the average reimbursement for a TCD with Medicare is just over $500. With commercial, it's more than that. Um, I think it becomes more of a burden on the healthcare market if we don't do it. Okay. In other words, if we're able to pick up individuals that are high risk for stroke that need immediate attention, and we're able to mitigate that issue and eliminate all a surgical intervention or more so than that, and really have a real sick patient that's going to require hospitalization for weeks or months. I think we're doing the opposite. So I feel that the burden on the healthcare system is lessened by us doing this test on a regular basis.
Jerry, that's all the questions I had for you. I appreciate your time. You've been a great client, a good friend, and go help your mom.
All right. Thanks, you guys.
All right, take care.
Take care. Bye bye.